Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. We appear to be moving in the right direction. Not only do we need to remain vigilant, but also cautious. We also need to prepare for a still uncertain future. What should I do next? I bet that's a common question. Today, we'll focus on communication strategies to rebuild consumer confidence. We'll get a practical look at COVID-relevant federal and state policy. Hear the latest on COVID-19 and the mass vaccination program well underway. Once again, lots to cover. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are John Hutter, Director of Brand and Marketing at Northern Light Health, Lisa Harvey McPherson, Vice President of Government Relations at Northern Light Health, and Dr. Jim Jarvis, Director of Clinical Education and Incident Command Section Chief at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Our panelists will share some key information first, then we will have questions and answers. First up is John Hutter with communication strategies to engage consumers. John?
Thanks, Dr. Gilkey. Good morning, everyone. I hope everybody is doing okay this morning and is starting to feel a little bit warmer as we move past that really cold week we had earlier. I want to talk today about communication strategies for building consumer confidence. And I was thinking about that challenge and the idea of strategies to build confidence. And confidence is important, which is why consumer confidence is a leading economic indicator. I just checked and the February number is up slightly from January. So confidence is moving in the right direction. And confidence is contagious. And it's an interesting word choice at this time, but I think it's appropriate. And I thought it was an interesting slogan. I thought, hey, I actually might be onto something. I'll put my name on that and it'll be confidence is contagious, said by John Hutter. But I thought I made it up. I didn't. It was actually made up by the old football coach Vince Lombardi. You look it up and his name comes up. He also said that lack of confidence is also contagious. So you're going to set the tone in your business for what's going to happen. Nobody really knows what the future will bring, but people want to feel secure. What we really see now, and you see it in the news, you see it all over, people want to feel safe. They want to feel confident because the last year has been anything but. People are unsure. So anything that they can hold on to that builds confidence. And if your business and if you can provide that symbol of confidence, that's going to be really important. Whatever your strategy is, commit to it. If you're providing remote service or curbside service or a phased opening, or you're working, remotely, commit to your plan and explain that that's how you're going to be doing business and provide a timetable if you're looking at changing that. Use your appropriate safety measures as part of that plan. And make sure your employees are aware of your strategies. Their confidence comes from you. They should have the same level of confidence that you do, that they understand where your business is going, how you're going to serve your customers, how you're going to move forward. So that confidence is really important. And you are the tone setter for that. As responsible for your business, people will look to you. You are the leader and you're the leadership. Next slide, please. This is a process and it's about building habits. And the idea behind habits is creating that process. Don't take any of your customers for granted, which means the first thing you need to do is rebuild the habit of your business. When people come into you, it's a habit. If you've got regular customers, they do it by habit. That's, regular customers and habit. That's what it means. At the same time, you have an opportunity to reach people who have fallen out of old habits. You can create new ones, and you can reach out to new customers and build a new habit of your business. I'll just click to the next element. The whole world is changing. So even though you may have customers who have stayed with you, if you have shut down for a time or if you change the way things are going, there is an opportunity there because you're not alone. The whole world has changed. So there's an opportunity to create new habits and bring new customers into the equation and build your business. That opportunity is something, I don't like to say we take advantage of the situation, especially related to COVID, but you do need to do that. And confidence also comes from repeating. If you do things over and over and you've been positively reinforced, repeat customers are confident in their choices and they're confident in your business. Go with what you know and make people know you and make sure that's in your message. And all of that is designed to build loyalty. And loyalty is the groundwork for success in business. With loyalty comes your desire, if not your obligation, to reward that loyalty. If you haven't done so before, think about how you can reward frequent customers or even regular customers. We've been paying attention to some recent advertising. McDonald's now has a loyalty program that's in test. In fact, they're testing it in New England. They've never done something like that before, at least not in the United States. And they'll be using it like other companies do as well. It's for rewarding behavior, for yield, for traffic management. They're going to be integrating within a mobile app. And they're also training their employees on how to reward that loyalty themselves, how to greet customers by name. Imagine being greeted by name at McDonald's. It's just not been in their model before, but they know that nothing can be taken for granted. Their business has already, fallen off. What can they do and how can they take advantage of this opportunity to build new habits, to create new customers? And you don't have to be big to have a loyalty program. Just understanding and knowing and keeping track of your customers is an opportunity to create that regularity, reward them, and give them bonuses for that. Think about what you can do on the spot with little extras that a customer might receive from you. A low-cost item can yield a big return. And thinking about your regular customers too, we're always looking for new customers and we're trying to create incentives. But what have you done for your regular customers recently? Other advertising you might have seen. AT&T, for example, shows that some of their cellular deals are not just available for new customers, but for existing customers as well. So anything you can do to build habits, to create that loyalty is really important. And next slide. So if you created that loyalty and rewarding those people, you're creating a following. So with that following, you have an opportunity again to tell people what to do. I used to work with a copywriter. He's actually was very renowned, but he always said, it amazes me. We create advertising. In the advertising, we tell people what to do, and then they do it. So tell people what to do. I'm using social media icons here because they tend to be inexpensive. So no matter what your business level, you should be able to have a presence on Facebook. If you're looking for people under 40, you want to think about Instagram and some other channels as well. Use a YouTube channel to be able to tell stories. And I think of all these icons, email is one of the most important. It can pay off the most, and it's the most trackable. Keep track of your customers' email. Use several channels, but you can use that again to create a following. Ask people to follow you and give them a reward for doing that. Email specials, new items, social media specials. The purpose here is to build an audience, and it's really a basic tenet of media, whether you're using these social media, whether you're using traditional media or digital media. Their purpose is to give you an audience. They deliver that, but it's up to you to create that right message. And remember, going back to the beginning, that message should build confidence. We are here. Here's how we're going to be open. Here's some specials. Create the reason to follow you and the reason to create some loyalty for you. Next slide. Don't forget to do more. We should all know the benefits of community service, and being of service and contributing is going to mean more now than ever before. What you do as part of your community also signals that you are here and that you plan to be here. It signals a return to connecting, to being together. What people really want also now is to be able to get out, to connect with other people. When I see people together, they cannot help but want to talk to each other because they're missing that connection. So if you're supporting community events or things where people can feel more normal and feel connected, they'll associate that positively with you. And you'll also have a chance to interact with people without asking them to buy something. It's not always, hey, I'm here, buy from me, but just to know that you're there, that you're part of the community, that you've connected with them. And next slide. I want to focus also at this point on your employees. None of this happens without their support. The idea that confidence is contagious works only if you impart that confidence on them. They need to be able to speak for you. You can't speak to every customer. Maybe you can, but depending on the size of your business, they have to advocate for you and they have to believe in what you believe. That only comes if you support them. Hearing their concerns, providing them support, and showing them the path to winning will make all of them your advocates. The person we're showing here is Christine Taylor. In terms of providing for employees, Christine is a Beacon Health wellness coach. She's actually my wellness coach, and I'm going to meet with her in a little over an hour at my lunchtime today. It's a valuable program to take care of employees, to provide employee wellness programs, because if you do for your employees, they'll support your confidence and they'll do for you because they believe in you. Be flexible. That flexibility can help businesses survive, and being flexible and supporting your employees is a really important part of their support for you. The same as it's going to happen moving forward. Business is going to change. How you change and how you support your customers, your employees, all comes together. So this last slide supports all of the, is really summarizes the points I just covered. Remember, building confidence starts with the confidence you have in your plan. That is contagious. Create loyalty, rebuild the habits. Think about how you can do that. Capitalize on your opportunities. Take advantage of the uncertainty. And again, I hate saying take advantage. People are uncertain. Give them reassurance. Instill confidence in them, instill confidence in your employees, and you've got a good chance to succeed and look forward. Always be of service, take care of your employees, and it all comes back to taking care of you. And thank you.
Yeah, thanks, John. Next is Lisa, who will provide insights into current governmental policy. I warn you, when Lisa is done, you'll come to realize how fascinating policy can be. Lisa.
Good morning, everyone. Thank you for the opportunity to meet with the group today. I appreciate the invitation from Beacon. We're going to start with a federal update. There's a lot going on in Washington, D.C. with the reconciliation package. And I'm going to start with focusing on what the House passed. So the House passed their reconciliation package actually last weekend. And it seems like last weekend was a month ago. There's so much going on. But the House package serves as the framework for the work that's going on in the Senate this week. So the House did approve a $1.9 trillion COVID package. The president had campaigned on this. This is largely the framework that the president advanced. But what you see in that package is resources that are really important: funding for vaccines, for treatment, for personal protective equipment, for testing and contact tracing, for public health workforce development. And there are some initiatives there that look at the Department of Labor and workforce protections that will be led by OSHA. And there are some other non-healthcare specific pieces of the package. There's support for families and small business. And I have a slide that will review some of the supports for businesses that will be of interest. Now, the package does have the $1,400 stimulus checks. Individuals earning an adjusted gross income up to $75,000 or married couples up to $150,000 will receive the check, plus $1,400 for each dependent. Now, this piece of the House package is under discussion in the Senate. And what I'm reading is that there will be a faster phase out above these earning benchmarks. It will phase out faster for a limited amount of stimulus check going to individuals. That's, I think, being debated as we speak. And the House included a $15 minimum wage. Now, the Senate will be taking that out because the Senate parliamentarian has ruled that including this violates the very strict Senate rules on reconciliation. And I have a slide where I talk more about what is reconciliation in the Senate. Next slide, please. So items of interest to business. So there's a temporary expansion of the health insurance marketplace subsidies. Now, this is different from President Biden's executive order that opened up the exchange for a special enrollment period that we are in now, and that enrollment period is open until mid-May. What the House bill does in the reconciliation package is provide more financial support for individuals within certain economic indices to be able to purchase insurance on the exchange and have financial support to do so. It also contains federal subsidies valued at 85% of the health insurance premium to support qualified individuals and families to remain on employer-based coverage. This is what we refer to as COBRA. Now, this is another item that's being discussed for a little bit of change in the Senate, and there's discussion, and it may have been approved by Democratic leadership to have full support, not 85%, but full support for individuals to retain their COBRA coverage. It importantly does reinstate until September 30th the mandatory paid family and medical leave provisions. Now, these were established in the laws that were passed earlier in 2020, but this did expire at the end of December. So this will reinstate that family leave, and it also extends eligibility to additional self-employed workers and increases the total value of the leave to $12,000. And there are some other provisions in there too. The Paycheck Protection Program, great program of great interest and support to business in all different types of sectors. And this bill modifies PPP to clarify some of the small business affiliation rules don't apply to certain applicants, and then specifies that 501c3 organizations that employ not more than 500 employees per a physical location of the organization become eligible for the program. And importantly, it also provides an additional $7.25 billion for the program. So if you're here participating as a business individual, I think all of these items in the package are of great interest to you. Next slide. This is where we'll talk a little bit more about what's going on in the Senate. So the reconciliation process is a very interesting process. It's a process that allows a reconciliation order to be passed, and that order directs certain committees to craft pieces of a proposal with spending or saving benchmarks, and all of those proposals are put together into one big package. That's what happened in the House. Then the bill comes over to the Senate, and the Senate's going to handle it differently. Senate leadership, not committees, but Senate leadership will determine the content of the reconciliation bill, and it's all subject to the Senate parliamentarian approval. So if you ever heard of something called the Byrd Rule, that's the rule that says there's very strict criteria that determines what's in and what's out of a reconciliation package. So that's why the $15 minimum wage increase will be removed. It doesn't meet the Byrd Rule standards. But when that happens, $67 billion in the House package will be freed up, and senators are working to reprioritize. There's money available in this package now. How can we reprioritize on other spending proposal? That horse trading is going on all week long. Now, for healthcare, we have an important priority. When the Senate was first voting to frame up the reconciliation order, they had a process that's called vote-a-rama, and that occurs at the beginning and the very end of the process. And that means any senator can submit any amendment that they want, and it must be considered. So our senator, Senator Collins, co-sponsored an amendment with Senator Manchin to add $35 billion in the CARES provider relief funding to the reconciliation order, and 20% of the funding must be dedicated to rural providers. This is the money that goes to hospitals and nursing homes and home health and doctors, all different types of providers all across the country, to help offset the financial impact that COVID had since the beginning, really, of the pandemic last spring. $178 billion was originally appropriated in the CARES Provider Relief Fund, and by the end of March, that will be down to $4.4 billion. And we all know, there's a lot of work going on as we speak, and so building that fund back up to be distributed where providers are in need is really important to healthcare. So now we're working on the back end, since this wasn't included in the House package, to say to our senators, this is really important. We want this included by way of an amendment in the final Senate package. Now, Senator Joe Manchin from West Virginia is leading this effort. And where the Senate vote was 99-1 on that first vote, we're hoping to have a lot of Senate support, and we're certainly working with our senators, Collins and King, on how important this issue is. So when will we be done? When will this be done? Well, we're going to start and wind the clock back. We're going to take a look at March 14th, because that's when the enhanced unemployment benefits expire. So this law must be passed before March 14th to prevent disruption in those unemployment benefits. So what we expect to happen is the Senate will begin debate and voting this week. Now, Senator Ron Johnson wants the entire bill read before the Senate. It's like a 500 or 600 page bill. That will take a bit of time. Then we're going to have what we call vote-a-rama and 20 hours of debate. So it's probably going to be this weekend when the Senate votes on the package. Then, because it's different than the House package a little bit, it goes back to the House. They will vote to accept the Senate package, and then it goes off to President Biden for his signature in advance of that March 14th date. That's what we're thinking is going to happen. Next slide. Okay, we're going to talk a little bit about, some priorities here at the state of Maine. When the governor submitted her supplemental budget that balances spending between now and June 30th, she had a tax interpretation for the Paycheck Protection Program for Maine businesses. And in a bipartisan way, Democratic members and Republican members had concern about the impact on business when we didn't conform with the tax interpretation that was at the federal level. And she heard that, and she directed her executive team to take a look at alternative proposals. So she came back with a revised proposal on tax conformity. So today the governor proposes to treat the PPP loans up to $1 million as tax-free, while also allowing businesses to deduct expenses associated with a loan up to $1 million. And then for businesses with loans above $1 million, the state would match that double benefit on that first $1 million, but then maintain standard tax treatment for proceeds in excess of that amount. Now, above $1 million, I'm reading from the chamber, that's about 250 businesses. And this is where the debate is right now. Republicans want full conformity with federal tax policy. The governor has put in her proposal. Full tax conformity costs about $100 million, and the governor's revised proposal costs $82 million. So literally today, the Appropriations Committee will be meeting. They may be meeting now, and they're working on the supplemental budget, making key votes on what will be in, what will be out, what will be amended. So I expect by the end of this week, we should have a supplemental budget package so businesses will know how this aspect of their tax responsibility will be treated for this current year. Next. I'm going to talk about economic development. We are in the process of finishing up the supplemental budget, working the governor's biennial budget, and by and large, the governor's biennial budget is pretty reasonable. Doesn't raise taxes, achieve some savings without being highly disruptive, make some investments. I do need to say I'm working on some cuts, main care cuts that are highly problematic for hospitals, particularly during a pandemic where our position is you don't cut hospitals. But that's work that I'm working on at the State House, and that's not the focus for today. So I want to think about what will be the avenue to invest in workforce. What's the avenue to invest in economic development? And when the governor had her state of the budget address, she gave us a vision of what she's going to be putting forth, and it's going to be a back to work bond proposal. 30 million in broadband, 25 million for career, technical and community college centers, 50 for farmers, foresters, and fishermen, 16 million in grants on low interest loans, and some critical infrastructure investments. I think there will be bipartisan discussion around bonding for economic development and workforce development. In fact, we have a Republican bond in that significantly invests in the community colleges. That's all months from now. Got to wrap up the budget. So sometime around April into May, then we will talk about bond investment to support workforce development. And that concludes my brief and swift overview of state and federal priorities, and I'm going to turn it back to Dr. Gilkey.
Well, thanks, Lisa. I always feel smarter when I listen to you, I have to say. Next up, Dr. Jarvis will provide us with updates on COVID-19 and the vaccination program. Jim, thank you for your leadership role in helping all people in Maine who want a vaccine get a vaccine. Jim from the Cross Center.
Thank you, Ed. I will note that you've never said that I make you sound smarter either, so I don't know.
You actually do. I will state that publicly.
So as Ed said, I am here at the Cross Insurance Center in Bangor. I'm in our command center, so if there's a little bit of background noise, I apologize for that. Let's talk about some changes since the last time we met just 2 weeks ago. A lot of things have changed. The first is that the governor has extended eligibility for people to receive the vaccine to now individuals who are age 60 and over, and that started yesterday as a matter of course. And so just here at the Cross Insurance Center, but around Northern Light and around the state, we have seen several individuals who have taken advantage of that. And that's good news. Continue to get asked, why is it that we're using an age-based strategy when we see around the country various other strategies being used, particularly ones focusing in on chronic disease management. And the slide that we have here actually shows the reasons why. So what this slide is it really talks about the mortality rate, or the rate that people die who've been infected with COVID-19 based on separate categories. And if you see at the top there, this is basically, we won't go into what the statistics are, but basically this is just a reference range. You can see that people who are age 18 to 41 are set as 1, and that's the standard risk for dying from COVID-19. And then if we look at several different categories, age, sex, race, and then chronic conditions, we see that at the very, very top there, the highest risk is those individuals over age 75, meaning they have a 35 times more likely risk of dying from COVID-19 than individuals who are 18 to 44 years of age. But you see, even people who are 45 have almost a 4 times relative risk to people who are under the age of 45 for dying. And so age actually is the single best predictor of mortality from COVID-19. If we compare it to certain other diseases, ones that certainly make the news on a regular basis, such as people with diabetes, you can see that their risk is actually only slightly greater than the risk of somebody who is age adjusted under the age of 44. Even individuals with cancer, where we know that their risk factors are higher, still they're just slightly a higher risk of mortality than individuals under the age of 45. So it really is that focus. If the governor's intention was to save as many lives as possible in the shortest amount of time, an age-based strategy actually makes sense. It also does incorporate chronic diseases. As we know, as people get older, it is more likely that they will have a chronic condition that puts them at risk. And so it actually does take into account individuals that have chronic conditions. Does this matter though if you happen to be a 35-year-old who has diabetes and is being treated for cancer, and you also happen to be obese and a smoker? No, unfortunately for that one individual, it seems like this is an unfair system. But the fact is that when we're talking about population health and trying to save as many lives as we can in the most efficient and quick fashion, when the resource that we're using, in this case vaccine, is of limited supply, this actually makes the most sense. It's not only based on science, but it also logistically makes it easier for us that are on the front lines doing this vaccination, because it's easy for us to determine whether somebody is 65 or not. It is hard for us to determine whether somebody has a chronic condition. What we've seen in other states that are using a chronic condition-based strategy is they actually added a barrier to getting vaccinated. You now have to go to your doctor's office in order to get a note that says that you have this chronic condition before you can even schedule your appointment. So it's just one more step, one more barrier, and this process relieves that. So next slide, please. So COVID vaccines, new on the front since we last talked is that Johnson & Johnson vaccine was given emergency use authorization. Again, there is no vaccine that is given that at this time has complete FDA approval, though we expect that to happen with Pfizer and Moderna shortly. Right now, they all work under emergency use authorization. That does not mean that they did not go through rigorous trials. And you can see in this chart the number of people who had received the vaccine in those trials, and those are significant numbers. Even more so as you talk about for Pfizer and Moderna, now there are tens of millions of individuals who have received that vaccine. So even while we look at those numbers for the original trial, we now have data, really strong data, after those tens to millions of people have received it. But really what I want you to focus in on is that column that says protection from COVID-19 hospitalization at 28 days post your second dose, or in the case of Johnson & Johnson, its first dose. And you can see for every one of the vaccines, the 3 that are now currently under emergency use and 3 others that may or may not be able to be used in the United States shortly, all of them showed 100% protection from hospitalization 28 days after completion of the series. That's remarkable. We don't see data like that in any other vaccine. These are incredibly efficacious vaccines. And not only that, the safety profile is amazing on them all. Like I said, for Moderna and Pfizer, we now have tens of millions of individuals who have received the vaccine and have seen no major complications from either of those 2 vaccines. So this is a time in history where we can say, man, the human race did a great job because our scientists did wonders in creating these vaccines in such a short time. I will state once again, like I've said in the past, all of these vaccines are based on scientific principles that we have been using for decades. It's just that they're new for this particular virus. So next slide, please. So now, educators. So we've had to change this slide quite frequently over the last few hours, as a matter of fact. So on Friday, the governor, when she had made an announcement that that they would also not only be vaccinating individuals over the age of 60, but that they were asking for vaccine clinics to prioritize people who are teachers or work in schools who were also over the age of 60. And as of yesterday morning, most of us had submitted plans to do so. However, last night, the governor announced that she was going to follow suit with President Biden's edict that we needed to prioritize all people who are teaching K through 12 and the support staff who support that endeavor and those who are doing childcare as well. And so the governor did state that we will be working towards that. The president's goal was to have all of these individuals receive at least 1 dose of the vaccine by the end of March. I think that's a little ambitious because that's actually adding quite a number of individuals to the roles that we had not anticipated when we made that shift to individuals over the age of 60. And so, so it will be a little bit complex. Again, we will ask for patience. But this plays a dual role. We do know that our children who are not in the classroom are not learning at the rate that those children who are in classrooms. So it's prioritizing to try to get our schools to be as open as we possibly can while maintaining the safety of the individuals who are working within those school systems. And it's also from the standpoint of a workforce. Many of us have suffered when a school goes completely remote, and then our workers have to stay home with their children because their children can't be attending school in person. And so it's a really multifactorial when we start talking about ways that we can make it so we can get our schools and make sure that and ensure that childcare continues as well. And with that, I think that's my last slide, and we'll turn it over to Ed to start doing the question process.
So with that up-to-date information, you have made me smarter.
Okay, I don't know, Ed, my head is spinning. The last 12 hours have been a whirlwind.
Oh, man. Yeah, well, actually, it seems like you've been in a whirlwind since December with vaccinations, quite frankly, and thanks for all you do. It's
and
great.
Some would say I've been in a whirlwind since last February when I took over this role.
We won't go there. So now we'll focus on questions. I will group similar questions together so we can address as many questions as possible. And it turns out my first question is for you, Dr. Jarvis. Do you think numbers of people vaccinated in Maine will accelerate with availability of the new J&J vaccine? And I'll add a question myself onto that one. We recognize that J&J are pulling off the shelf the preparation for going live with the EUA. But then there seems to be a lull coming at us and then a ramp up. And I think Merck is getting involved in some ramp up as well. So if you could cover the J&J vaccine, those aspects of it, that'd be great.
Sure, Ed. So one of the advantages two advantages of the Johnson & Johnson, one is that right now it appears to be a single shot. There'll probably still need to be a booster, but still details on that remain fuzzy. And the second is that it's just like many of the other vaccines that we typically use that can be stored in a normal refrigerator. And when I say normal refrigerator, not your home refrigerator, but one that we use for medical grade facilities, rather than the ultra cold freezer or the low temperature freezers that we need to use for Moderna and Pfizer. So that means that it's something that we can get out, particularly to rural communities and certain populations that right now they have trouble getting to one of our large scale. So those are the good news. The questionable news is really what you said there, Ed, is that there's about between 1 and 2 million doses that Johnson & Johnson had on hand, and that's all been shipped. But there's nothing else left on the shelf. And so we do expect that while Johnson & Johnson will be available in the state of Maine, it'll be in very, very low doses originally. And there'll probably be then a period where there won't be any doses available until Johnson & Johnson can ramp up their production. I remind people that it takes a very long time to produce a vaccine. And so while I don't know the exact numbers for Johnson & Johnson, typically for a vaccine like this, it takes about 200 days from the start of the process till the time when the vaccine is ready to be distributed. So we don't know where they are in that production line with their vaccine. And while it's welcome news that Merck, one of their rivals, will actually be partnering with them to ramp up production, even if they started today, it will still be many months before theirs starts hitting out into the community, because it does take that long to create it. Again, that's one of the advantages of Moderna and Pfizer. They take about 140 days from the start of production to be able to be administered. So that's a shorter time, but still a pretty long time. And so while Johnson & Johnson is a welcome news for us, it will not be something that helps us to ramp up vaccination over the next few weeks, and probably not the next month or so.
So all that's useful information for our folks who are trying to figure out what does the summer tourist season look like. So thanks, Jim. The next question is for John. I'm trying to think what's most important to my customers. Is safety the key message for my customers right now? John?
It's a good question. Safety is an important message. I wouldn't call it the key message. It is price of entry. You need to tell people about your safety, requirements, habits, but don't brag about it, because that's not the only reason why they'll come in. It's a reason for them to stay away, but not the reason for them to come in. You're working, you should be responsible, but that will put you on a level playing field with every other business that's responsible. So again, it's tell people about it, don't brag about it.
Great. Well, that's very helpful. Thanks, John. The next question is for Lisa. Do you anticipate changes in Washington that will increase the supply of vaccinations?
Yes, if and when the reconciliation package passes and is signed by the president, it contains $20 billion in funding for vaccines. Now that's both for the administration of vaccines and for the distribution of vaccines. So certainly some of that money will be coming to the state of Maine. The package that passed at the end of December included $12 million in vaccine support that was allocated to the state of Maine. Certainly there was much more nationally, but 12 million came to Maine. So we expect more to come from the reconciliation package.
Great. Well, thanks. Lisa, I have another question for you. Do you think I will have to adjust my business to a $15 minimum wage in Maine this year or next year?
So that's an interesting question. I'm going to start with a state answer and then follow up with a federal answer. At the state level, we had a local referendum in Portland that really established a $15 minimum wage. There's actually legislation in the State House that would give the state sole authority to establish the minimum wage and hazard pay with certain exceptions. So that's really kind of targeting these referendums that occur in one community but are not statewide. That will stimulate a discussion around the Portland minimum wage, but I don't really see that advancing. As I mentioned, at the federal level, $15 minimum wages come out of the reconciliation package. There is discussion in a bipartisan way. What would the right minimum wage be? Is it $10, $11, $15? That discussion is occurring. And the line of sight that I have is there's an opportunity for a second reconciliation package at the end of the summer or early fall. Now, we don't know yet if it's an economic package, if it's a COVID-related package, if it's an infrastructure package, but knowing that the minimum wage isn't in this package sets the stage. Could they craft the reconciliation order to have it in a package in the fall? So that's what I'm going to be taking a closer look at once we know more as time goes on.
So I'll follow up a quick one, Lisa. So for our small businesses where the minimum wage might be a very sensitive issue, is the best way to communicate our participants' viewpoint on this subject through our senators and representatives? Is that the best way to go?
It's always important that our elected officials hear from their local businesses. So that line of communication is really critical. And the chamber is also an important voice. You know, we are very active and members of the chamber, and the chamber is very often a voice, a collective voice representing a lot of businesses, both at the state house and at the federal level. So direct communication, it's always important for elected officials to hear from who they're representing. And the chamber is a bigger voice that you also want to be part of.
So make your voice be heard.
Yes.
Great. Well, thanks, Lisa. John, I have a question for you. What are some ways to build employee confidence in what we are doing? That seems to tie into one of the slides that you had shared with us.
Yeah, you know, related to things like employee wellness and, you know, what we're doing for them and the confidence. The first thing is you got to communicate. You've got to tell people what your plans are, and you got to do it regularly. You know, one of the things, you know, we do here, of course, is shift huddles. And, you know, if you're not in the habit of daily just giving a quick briefing on what's going to happen today, what's going to happen in the next shift, what's going to happen in the next 24 hours. I mean, sometimes businesses don't need to be that reactive, but it's a good habit to get into, even if it's only 5 or 10 minutes to start the day. That stream of communication makes it two-way and shows that you do care. You know, the staff meeting is, you know, sometimes it's the dreaded staff meeting. We got to take an hour of our time when we could be doing something else. Take advantage of those times. Make those engaging. That's where you need to build the confidence. That's where you also need to support your employees. You know, the old ethos was, you know, you're a trooper. You know, you came in when you were sick. You know, you toughed it out. You know, don't do that. You know, and encourage people. You know, take care of yourself. I'm here to take care of you. You have to be responsible for some self-care too. Call in sick, you know, and if you're feeling sick the next day, do that. And, you know, if you're in a work environment where maybe masks are not always required because there's distancing, or, you know, if you're connecting with people, make that masking thing a habit now. You know, I'm thinking, you know, for myself, if I'm even feeling a little off and I go out just to go shopping, I'm going to wear a mask from now on. I mean, I never thought of that before, but that's a smart thing to do. But using those channels of communication, employees love communication and they hate being kept in the dark. That's what you need to do.
Yeah, so kind of taking care of yourself first, and yourself in this case includes your employees in terms of the business taking care of itself. This reminds me of a recent analogy that one of our speakers used where when you're on an airplane and the oxygen mask drops, you know, put yours on first so that then you can help someone else. So I think that actually captures your ideas pretty well. Thanks, John.
That's a great one.
Yeah. Dr. Jarvis, why do I hear about another surge possibly in March? That doesn't make sense as more people get vaccinated. What are they talking about?
That's a great question, Ed. So it's twofold issue there. So one, we have not vaccinated enough people to start seeing decreases in the overall population as far as COVID-19. I will say that we think we have started to see a decrease in the rate of infection amongst residents of long-term care facilities, because here in Maine, we have had a larger percentage of them accept the vaccine than we've seen in other states. So if we remember in the beginning of the pandemic, that's what most of our outbreaks were all around long-term care facilities. And right now we're not really talking about that much. So why the increase though? There's a couple of reasons. One, people, when we start hearing good news, we start hearing people let their guard down. So we already know there are 2 states where governors have decided to remove all restrictions around COVID-19, despite the fact that their numbers are still pretty high. And so I think there's that. People are tired, they're frustrated, and they hear some good news and say, oh, now's the time I can abandon wearing my mask. But that's not the case. And so when that happens, that causes spread. And there's also the issue of the variants. And so when we factor in the variants, particularly the variant that was first identified in the UK, the one known as B117, that one spreads more rapidly than the virus strain that's predominant in the United States. And so as we see that one become more active across the country, more people will be infected. And so that's the reason why we continue to talk about a March spike. But here we are, it is now the 4th day of March. And we in Maine, we still seem to be doing well. But I will tell you, I watch the numbers very carefully, and I'm one of those people that kind of looks at the in between and the underneath, and I am a little bit concerned, particularly in Penobscot and Piscataquis counties, where we haven't seen the leveling off that we've seen in our other counties, and in fact have seen a slight uptick. But it's not a trend yet. It's not time for us to panic, but it is a word of caution that it doesn't take more than one person being infected in a large area that all of a sudden causes us to have a large outbreak or another surge. So that's the reason why those predictions are still there. We hope they're wrong, but that's not the strategy we should go with. The strategy is let's do all the things to prevent it from happening, wear our masks, wash our hands, stay physically distanced.
So really we're reinforcing no let up.
That is correct.
Mm-hmm.
And
Okay,
don't
great.
go visit Texas or Mississippi.
So a follow-up question for Dr. Jarvis. We have elderly constituents call who don't have access to computers or are nervous about using the online portal. Is there an alternative way for them to sign up for an appointment to get vaccinated?
So it's another good question, Ed. And I'll say that Northern Light Health does have a phone line, and so that phone line is readily available for people to call that can assist them through the process. We also know that many of our area agencies on aging also are assisting individuals to navigate the system, as well as other community members. And so what I say to people is, if you can't do it yourself or you have some concerns, please reach out to family members, friends, and other people that you trust within the community. We know it is difficult, but again, the issue is here purely volume. We're trying to vaccinate over 1 million people. And that just takes time, and anything we can do to ease that, we will. And then if you can't figure out our system, we can find somebody that can help you.
Great, thanks. Jim, I do have one more for you here. What guidance can we provide for our employees who have been vaccinated around travel and what is expected when they return? So for instance, do we need them to quarantine 72 hours before COVID testing and then return to work in person once negative? And then I'll layer on to that, in Maine, we've got a new directive, I believe, for international travel, which does require quarantine.
Yeah, so right now, Maine has not updated its travel restrictions regarding vaccination. That may be coming. We do know that there are other states and there is some federal guidance around making it a little bit easier when it comes to travel. Maine reinforced, as you said, the issue around international travel, that people who have traveled from outside the country back into the state of Maine do need to quarantine. The rest of us can use the testing-based strategy, so could come back in and get a negative test within 72 hours of crossing over the border and then being out of quarantine for that reason. And then similarly, if they can't get the test, then they do need to quarantine for 10 days after travel. So that's one of those things that we expect to change as more people become vaccinated in the state of Maine, that there may be some travel restrictions that are removed, but right now we are currently doing the exact same thing we have been doing.
Thank you. Jim, one more on vaccination, lots of interest there. Will there be people who will go to elder folks' home to vaccinate homebound, and you might tie into the home care workforce as well.
Yeah, so that's actually been happening since the time when we were able to start vaccinating people in the general population age 70 and above. And as Ed pointed out, our Northern Light Health's own home care and hospice agency has been doing that on a regular basis. In fact, they're one of the leaders in the state about going to not only long-term care and assisted living situations, but also in housing that's designated for individuals who are over a certain age. And so we continue to do that. We are hopeful that with the Johnson & Johnson vaccine that we can actually start to then pinpoint down to the single individual. Again, this is one of those things where when we think individually, it certainly becomes complex versus when we think of a giant population. And so right now, at the Cross Insurance Center, for example, we are vaccinating over 250 people an hour. If we were to take one person off of the line in order to go and vaccinate one person who is unfortunately unable to travel, that might mean that 249 other individuals during that same hour would not be vaccinated. And so that's where it just comes down to population health. It's hard decisions and people are making those hard decisions, but they're the right ones. At the same time, we try to partner with our community partners to be able to try to vaccinate those 1 and 2 individuals who may not be able to get to one of our large scale facilities until we get to a point where we have enough, something like Johnson & Johnson, where maybe we can start vaccinating at retail pharmacies or at private practices, or actually getting out into the home. But we are trying to do large community centers if we can.
Jim, I realize that you put a lot of effort into media briefings and helping get the word out on these mass centers. I can't help but think, are people worried about these centers as a source of getting COVID-19? Maybe take a minute or so and mention how it's structured and the safety involved.
Yeah, that's good. And we hear that. We've heard people say, oh, my mom or my dad or my grandmother is just concerned about going out. They haven't been out of their house since March. And now you want them to go into a facility where you're vaccinating 2,000 people. And it sounds scary. So one thing I would say is I'd point you to our website, which actually has videos of both the Cross Insurance Center and our newest large scale vaccine clinic at the Expo in Portland that actually shows you what our details are. First and foremost, we treat this as if this was a healthcare facility. So while there might be concerts here and the rest of the year, right now it is really considered like a hospital. And so people come in, they all have to wear masks while they're in our facility. We make everybody use hand gel when they come in. We do the screening questions. We take 10. We also it is well blocked off in each of our facilities to make sure that people are remaining socially distanced. All of our staff have been screened as well before they come to work. And so we try to make it as safe as possible. And I will say it's probably safer than most other locations people are in because we take safety as our #1 priority. The last thing we want to do is try to protect somebody with a vaccine but actually infect them with a virus. And so that's not happening. We have taken every strategy to make it as safe as possible. And all you have to do is just look at the wonderful response that we've been getting on Facebook and other social media of people who were nervous before they came here because they've seen these, exceptionally long lines on television in other states, and they come in, and the average time that somebody is in one of our clinics now is under 35 minutes. So that's the time that they leave their car, they get through the line, they get vaccinated, and they wait that 15 minutes. They are right back in their car in under 35 minutes. I had a lady yesterday who told me she was literally in and out of the building in about 19 minutes. So that means that it took 4 minutes for her to get through the line, get vaccinated, and her 15-minute wait time. So you're not here for extended periods of time, and we just don't have those long lines that you see. We have built these to be incredibly efficient and incredibly safe, kind of like the vaccine itself.
Yeah, right. That's very useful information for everyone.
Maybe that should be my new tagline. Our buildings are like the vaccine, efficient and safe.
There you go.
I've just now made the command center crack up, so I'm done for the day.
You're good. You're good. Well, thanks for sharing that. On a personal note, my wife had an opportunity for her first vaccine dose yesterday at the Cross Center, and it took 33 minutes. Her husband, who was actually sitting outside in the car waiting for her, actually timed it. So Under 35 was quite accurate in our case. Debbie in the chat room actually shares with us, have people call their local library for help with vaccine appointments. So thanks, Debbie, that's useful. We have another question here. This one's actually fairly specific, Dr. Jarvis. I have an employee traveling out of state who has had her first shot and will do the second upon return in 2 weeks. Should she still be tested for COVID within 72 hours? And if negative, does she still need to wait 10 days if she remained symptom-free? Oh, that's a lot to digest.
So again, the vaccine itself doesn't play a role in the travel restrictions here in the state of Maine. So yes, they will need to either have a negative test or wait the 10 days of quarantine. That should, however, not prevent her from he or she from getting their second dose if it happens to be an overlap there. The only time we're asking people to postpone getting their second dose vaccine is if they actually are symptomatic. Again, at most of the facilities and certainly all of the Northern Light Health facilities, you'll be required to wear a mask and have those screening questions asked before entering into the building. But I would not delay your second shot if they are asymptomatic, feeling well. And so that's my advice.
Yeah, great. Well, thanks. We just have a few minutes left, so we'll be sensitive to the length of our answers here. Lisa, a couple questions for you. With all of the additional expenses related to COVID-19 in Maine, do you see the Maine state corporate tax increasing? And how can I stay tuned to this so I can plan my budget accordingly?
Okay, so we do have one legislative bill. It's LD 501, an act to amend Maine's corporate income tax by increasing the top rate from 8.93% to 12.4%. That will stimulate a debate on this topic in the tax committee. Given the strong bipartisan support for businesses and the impact that COVID has had on businesses, I will be very surprised if that goes anywhere, but certainly that debate will occur at the public hearing before the tax committee. And once again, contact local legislators. The chamber is a great voice for collective business. So, there'll be debate. I don't think it will go anywhere.
Okay, thanks. A follow-up question here relating to the back-to-work bond proposals that you had shared. What seems to be the payment plan for the numerous back-to-work bond proposals?
So, bonds are issued by the state treasurer, but there's a big process between here and there. They take a 2/3 majority vote to pass in the legislature. Part of the process is evaluating the state's debt structure around existing bond and capacity. Then typically leadership will set a limit, and within that limit of bonding, then you have a lot of negotiation about what will be in and what will be out. But ultimately, it's up to the voters to pass those bonds, and then the treasurer can issue those bonds.
Great, thanks. Just time for one other quick question. Dr. Jarvis, I'm still unclear about reinfection. Can people who had COVID-19 or the vaccine get the infection or get it again?
So Ed, I'm going to give my non-scientific answer. We believe so. There are plenty of anecdotes out there of individuals who have been reinfected after having had the actual virus infection before. And we also know of individuals who have been vaccinated who have then come down with COVID-19. And again, no vaccine is 100%. We talked about before that 100% number was preventing hospitalizations, not infection. So the answer is yes, it can happen. And I understand that with the Brazil variant, it is becoming more common that people are actually getting infected more than once. So it's a good cautionary tale. Nothing gets you out of wearing your mask or the 6-foot distance rule at this time until all of us have been vaccinated and we get the overall amount of virus out in our communities down to a level where we can get back to normal.
Yeah, so we really walk away with the same messaging: vaccinate and don't let up. Okay, well, I think all three of our speakers made me a lot smarter today. We have included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to our speakers. I hope this hour has been a help to support you, your employees, and our communities to safely manage your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on March 18th. We'll be looking through the eyes of a fellow business owner, targeting the budget, preparing for the summer tourist season, and ways to secure personal protective equipment. We'll round out the session with an update on COVID-19 and vaccinations. This will be another session not to be missed. I guarantee it. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a good afternoon.